Have you ever felt like the world looks foggy, as if a thin mist covers everything you see? Let's begin with the story of Mrs. Kim, a 68-year-old woman. For years, she struggled with blurry vision. Reading became difficult, and driving at night felt almost impossible. The headlights of a car spread out into starbursts, and bright sunlight during the day made her eyes painfully sensitive. At first, she thought it was just aging. She tried new glasses, but nothing helped. Finally, she went to an eye clinic, and the diagnosis was clear cataracts. After cataract surgery and the implantation of an artificial lens, her vision improved dramatically. She described it as like the fog has lifted, and the world became bright again. Subscribes, likes, and turning on. Notifications are a huge support for creating more videos. What are cataracts? Cataracts occur when the lens inside the eye becomes cloudy. The lens works like a camera lens, focusing light onto the retina. When it is clear, vision is sharp and bright. But with age, the proteins in the lens break down and clump together, causing the lens to lose its transparency. This leads to blurred vision, glare, and faded colors. Globally, cataracts are one of the leading causes of vision loss, especially in people over 60. Common symptoms: blurred or cloudy vision, as if looking through fog or smoke. Increased glare and sensitivity to light, especially during night driving. Colors look faded or yellowed. Frequent changes in glasses, but vision never improves. Double vision, even in one eye. These symptoms start subtly, but gradually worsen, making daily tasks like reading, driving, or watching TV much harder. Causes of cataracts. The biggest cause is aging. Most people will develop some degree of cataracts if they live long enough. Other contributing factors include excessive sun exposure, smoking and heavy drinking, diabetes and metabolic diseases, eye injuries or trauma, long-term steroid medication use, genetic predisposition. So, while aging is natural, lifestyle and health management also play a big role. Types of cataracts. Nuclear cataracts, cloudiness in the central part of the lens, common with aging. Cortical cataracts, spoke-like opacities, around the edge of the lens, often causing glare. Posterior subcapsular cataracts, cloudiness at the back of the lens, interfering with near vision and bright light. Traumatic cataracts caused by injury can appear at any age. Diagnosis. Eye doctors diagnose cataracts with several tests. Visual acuity test to check sharpness of vision. Slit lamp examination to observe lens clouding. Retinal exam to rule out other eye diseases. Tonometry to measure eye pressure and check for glaucoma. Regular eye checkups help detect cataracts early and monitor their progression. Treatment options. In the early stages, stronger lighting, magnifying lenses, or updated glasses may help. But cataracts will continue to progress, and the only definitive treatment is surgery. Phacoemulsification phagosurgery uses ultrasound to break up the cloudy lens. The lens is removed and replaced with an artificial intraocular lens, IOL. This is the most common method with quick recovery. Laser cataract surgery uses a femtosecond laser for more precise incisions and lens fragmentation. Provides improved accuracy, but is more expensive. After surgery, most patients experience a dramatic improvement in vision, sometimes even better than before cataracts began. Post-surgery care. Avoid rubbing the eyes. Wear protective glasses. Use prescribed antibiotic and anti-inflammatory eye drops regularly. Avoid heavy exercise, swimming, or saunas for several weeks. Attend follow-up visits for monitoring. With proper care, complications are rare, and vision restoration is highly successful. Prevention and lifestyle management. While cataracts cannot be completely prevented, you can slow their progression with healthy habits. Protect your eyes from UV light. Always wear sunglasses outdoors. Quit smoking and limit alcohol. Manage blood sugar and blood pressure. Eat a diet rich in antioxidants, leafy greens, and colorful fruits. Get regular eye checkups after age 40. These steps won't stop cataracts entirely, but they can keep your eyes healthier for longer. Another case story, Mr. Park. A 72-year-old man noticed blurred vision for years. He delayed seeing a doctor until it became severe. When he finally visited the clinic, he was diagnosed with both cataracts and glaucoma. Because he waited too long, surgery was more complicated and recovery was slower than it could have been. This story shows why early detection and timely treatment are so important. Conclusion: cataracts are a natural part of aging, but they don't have to steal your vision. From blurred vision and glare to faded colors, the signs are clear and should not be ignored. The good news is that cataract surgery is safe and effective, restoring clear vision and improving quality of life for millions worldwide. So, don't wait until your world becomes cloudy. Get regular eye exams, take care of your health, and seek treatment at the right time. Subscribes, likes, and turning on. Notifications are a huge support for future videos. See you in the next video about eye health.